We are continuing our coronavirus outbreak coverage this morning by speaking to those who know the most about this disease. And we are joined this morning by Dr. Andrew Jameson, Chief of Infectious Diseases and Medical Director of Infection Control at Mercy Health. Doctor, good morning. Thanks for being with us.
Good morning. Happy to be here.
Well, let's first talk about this virus. I've heard so many different, ideas about what it is, and people, oh, it's just like the flu. Well, is it more like the flu or is it more like a common cold?
It is more like the flu in terms of the symptoms that can cause. The biggest symptoms that we have with the coronavirus are really the fever, shortness of breath, and cough. The fever tends to come a little bit later, but the shortness of breath and cough are very predominant symptoms, less of the runny nose and kind of sore throat, although the problem with this virus is it can present in many different ways.
Let's talk about if you do contract this virus, how long typically does it stay in your system?
Yeah, that's a little bit up in the air. Right now, we say that if you do get the virus, we want you to stay away from people, self-quarantine if you are safe to be at home for 14 days after symptoms start. We coordinate very closely with the local health departments and infectious disease and infection control professionals every time we have a case like that.
Now, if you contract this virus, you're not necessarily going to feel it right away, are you, the symptoms?
Yeah, the symptoms start slowly and they tend to build. So most of the time they start very mild, and that's why we have so many early warnings and people to look out for symptoms like a dry cough, like a shortness of breath. But you're absolutely right that the symptoms start mild and tend to get worse over time.
And I think that's the thing I think a lot of folks are confused about, doctor, is how long do I wait before I reach out for medical help?
Yeah, that is a problem for us as well. So I understand the public's confusion. One of the biggest things that does help us is the time frame. So because influenza and because regular cold viruses are circulating so much in our community still, that we pay a lot more attention to the duration of symptoms. So if your symptoms are mild for the first 1 or 2 days and you don't have risk factors in terms of to your personal health, or you don't have contact with patients or people that have contact with patients, we really encourage to hunker down, quarantine yourself, be safe around other people. And then if symptoms continue to progress, that is when it starts behaving less like the common cold and more like something concerning. So for us personally, I start looking at things at day 3 to 5. If the symptoms are continuing to get worse, that is when you should really contact your doctor. All the organizations in West Michigan have scripting that we've given to doctors and doctors' offices to look for in terms of symptoms that raise our suspicion and really prompt presentation to the healthcare setting.
Let's talk about what Mercy Health is doing to kind of address COVID-19.
Yeah, I mean, that's a long conversation. We are doing a lot to be prepared here. We're preparing for today, we're preparing for tomorrow, and we're preparing for what the future might bring. So we have adjusted our emergency response facilities. We opened a COVID-19 testing center. This is now day, I think, 9 for us testing people. We've been up and running trying to help our frontline staff in terms of primary care offices and urgent cares and emergency rooms for what to look for, how to screen people. We have access to testing. We have access to coordination across West Michigan. One of the things that's most encouraging so far from our response is the ability to reach out to Spectrum Health, Metro Health, the Kent County Health Department, and really doing a community-based collaboration. I've been really encouraged by the ability to work together. There's been sharing of supplies, there's been offering of resources. It's been a really great response, and it's been fun to be a part of an organization that is doing so much.
Where should folks go if they want to get some more information, doctor?
The CDC has amazing resources. Most organizations in West Michigan, so Mercy Health, if you go to mercyhealth.com, you have a coronavirus link that is open to the public that's patient-facing. Every government entity from Access Kent to the CDC to the Michigan State Department of Health, they have access and they have great resources available.
Dr. Jameson, thanks for being here. We'll talk to you next hour. Appreciate it.
Great. Thank you.
And stay with Fox 17 on air, online, as well as our mobile news app for the latest on the coronavirus outbreak. Remember, we have a special section on our website with everything that you need to know.